Hello, my name is Joanne. I'm one of the Obs and Gynae registrars. I'm here to actually talk to you about the role of the assistants, especially the role of the second assistant in total laparoscopic hysterectomy. Laparoscopic hysterectomy has now become a common procedure which is normally performed for either menorrhagia or early endometrial cancer. Therefore, junior doctors rotating into our specialty can be asked to actually assist in the procedure, and it may be your first time faced with the procedure, the equipment and the instruments used. Assisting in the total laparoscopic hysterectomy is like doing a dance. You need to actually coordinate with the first assistant and the surgeon in order for the surgery to be a smooth running procedure, and this in turn will help with patient safety. The aim of this video, therefore, is to explain the equipment, the procedure, and the role of the second assistant. The next section is to talk to you about the positioning of the patient. So generally the patient would be, this is the model, generally the patient would be placed in the dorsal lithotomy position in this stirrups. The second point to make about positioning of the patient is when operating laparoscopically, the bed needs to be as low as possible as it can be. At times you may also require a step in order to make sure you're in the appropriate position. This would actually help reduce any neck, shoulder or back injury. Where the surgeon and the first assistant generally stands, if you are a right-handed surgeon, you generally stand on the patient's left, and the first assistant will stand on the patient's right. The second assistant generally would sit in between the patient's legs in order to help manipulate the uterus into position. Okay. So prior to surgery, it is important that the surgeon actually examines the patient vaginally. So 2 fingers in. Okay. And the reason for doing so is to ensure that you are aware of the size of the uterus and the mobility of the uterus, and to confirm if the patient is still suitable for a laparoscopic hysterectomy. If you decide to proceed with the surgery laparoscopically, it is also a time for you to actually decide the size of the McCartney tube. Like any surgery, the principle of surgery is to perform careful dissection when the tissues are under tension. Therefore, the key role of the second assistant is to mobilize the uterus in a position so that there is tissue tension. This will allow the surgeon in order to able to identify the planes and dissect the tissue appropriately. The next section is to show you the equipment that the second assistant is likely to use. The first equipment here is the Sims speculum that would be placed in the vagina to help you identify the cervix. The second instrument here is the valsalum that would be used in order to grasp the anterior cervix. The third instrument here is known as the Specimen, which is a sort of uterine manipulator that would be placed, this portion would be placed in the cervix, and together with the valsalum is used to manipulate the uterus. The fourth instrument that you have here is the McCartney tube that would be placed in the vagina in order to help the surgeon open the vault. And finally, you have a laparoscopic grasper that you may be asked to use along with the McCartney tube in order to retrieve the specimen vaginally. So here I'm going to actually talk through with you what your role would be in theatre. So with the guidance of the surgeon, the first thing you need to do is to actually catheterize the patient. This needs to occur prior to surgery and before any instruments is placed through the abdomen in order to reduce any risk of bladder injury. The next thing that will be required is to actually place the Sims speculum in the vagina. This will help you identify the cervix. Next, grasp the anterior lip of the cervix with the valsalum. Okay. third step is to actually place the specimen through the cervix, and the specimen is then clipped and attached to the valsalum. Once this has occurred, the sim speculum is then removed. Your role as a second assistant is to move the uterus in whatever direction that you are guided by the surgeon. So you may be required to antivert the uterus, which is to put your hands right to the ground and push in, or you may be asked to retrovert the uterus, which is to lift your hands up and push in. You may at times be asked to neutralize the cervix, the uterus, which is to put it in a horizontal position and push in. Or you may be asked to move the uterus from side to side, which is to put your hands to the ground and to move your hands from either left to right in order to create that tissue tension. Once the vessels, ligaments, and bladder dissection has occurred, the next step is to actually open the vault of the vagina. Before this can be done, you do need to remove the instruments, and you do this by removing first the specimen by releasing this knot and removing it, followed by the valsalum. The next thing that you need to be aware of is the McCartney tube. Have a look at the tube. At the end, we have an angle. The longer edge generally needs to sit in the posterior fornix, and the shorter edge sits in the anterior fornix. The uterus sits in the middle of the tube. So it is important that the tube is always placed in this orientation. And the way to actually know that this occurs is by this little handle. The handle must always be pointed upwards towards the ceiling or 12 o'clock. If the handle is placed in any orientation, this would cause the tube to rotate and would make the plane difficult, and the surgeon will find it difficult to identify the right plane. It can also, if it's placed in the wrong direction altogether, there is always a risk that the surgeon may enter the rectum. Therefore, always keep the handle pointing upwards. Note that there's also, at the end of the McCartney tube, 3 little holes that is where you can insert the laparoscopic grasper in either of these 2 in order to remove the specimen vaginally. Okay, so let me show you how the McCartney tube is being placed. So first of all, part the labia, insert the McCartney tube posteriorly into the posterior fornix, and put your hands right down to the ground. That would antivert the uterus. Next, you generally would require to put firm pressure, and it is actually more pressure than you anticipate. This would help create the plane and would help the surgeon identify the right plane in order to open the top of the vagina. Once the top of the vagina has been opened, there's 2 ways that the specimen could be removed. First of all, you may be asked to insert the grasper in one of the holes through the McCartney tube in order to grasp the cervix. Once that is done, you remove both laparoscopic grasper and McCartney tube vaginally, and the specimen will be removed vaginally. Alternatively, the uterus may be pushed from the top by the surgeon, and the cervix could easily be identified from the vagina. If that is the case, part the labia, you could see the cervix, and remove the specimen with a valsalum. So when removing the specimen, do ensure that you wear a visor, or at least have a wet swab over the McCartney tube or your specimen, as there may be a lot of fluid around, as it may splash in your face. Okay, so the next section is to actually close the vault. A suture will be inserted at the top of the McCartney tube, and you are to actually replace the McCartney tube. Again, gently, and this time around keeping your hands to the ground so that the suture remains in the tube. The surgeon will grasp the suture from the top of the McCartney tube and will close the vault laparoscopically. Once that is done, they will check for any areas of bleeding, and when hemostasis is achieved, you can gently remove the McCartney tube. Right. Well, I hope you enjoyed the video, and I hope that you have achieved a better understanding about this procedure, equipment, and your role as the second assistant. And we look forward to see you in theatre.